breathing in and breathing out. It feels like the most basic thing in the world, right? But what happens when one part of that simple action just doesn't work? Well, today we're going to dig into the two main ways our breathing can get thrown off track. It turns out, when you really get down to it, most major lung diseases boil down to one of two fundamental issues. On one hand, you've got conditions where it's a real struggle to get the air out of your lungs. And on the other hand, you have conditions that stop you from getting enough air in to begin with. Two totally different problems with totally different causes. So, what is the crucial difference, really? Well, it all comes down to where the problem is happening. Let's start by looking at what happens when there's a blockage. Okay, first up, the blockage. This is the world of obstructive lung disease. And the name of the game here is that you just can't get the air out. Just like the name says, something is literally obstructing the airflow. It's not a problem with the size of your lungs or anything. It's all about the pathways for the air. The airways, they're clogged up, so trying to exhale becomes a serious effort. So let's break down the why. I want you to picture your airways like a bunch of pipes. In obstructive disease, these pipes get narrowed. You have bronchoconstriction, which is where the muscles around the pipes literally squeeze them tight. Then there's inflammation, where the walls of the pipes themselves swell up. And finally, excess mucus, which is kind of like pouring thick gunk into those pipes. All of these create a roadblock, making it so hard to push air out. And you can see right here some really common conditions that fall into this category. Things like asthma, COPD, they're all defined by this one shared struggle, getting the air out. All right, let's totally switch gears. If obstructive disease is a blockage, then restrictive disease, that's more like a squeeze. The problem here isn't getting air out, it's being able to get enough air in the first place. With restrictive lung disease, the airways, those pipes we talked about, they might be perfectly clear. The problem is with the lungs themselves or the whole structure around them. They just can't expand to their full size, so you can't take in that nice, deep breath. So why can't they expand? Well, think of your lungs like a balloon. With restrictive disease, it's one of two things. Either the balloon itself is made of stiff, hard material that doesn't stretch, that's like pulmonary fibrosis, or there's something on the outside, like the chest wall, or weak muscles, that's physically squeezing the balloon and not letting it inflate. Either way, the result is the same. You just can't get a full tank of air. And the examples here are pretty different, right? Pulmonary fibrosis is that classic stiff lung problem. But then you have things you might not think of, like severe scoliosis, changing the shape of the chest, or even obesity that can physically restrict the lungs from filling up. Okay, so we've got these two very different problems, a blockage versus a squeeze. But how do doctors actually see the difference? Well, this is where it gets really cool, because we can literally take a picture of someone's breath and make this invisible problem visible. The tool they use is called spirometry. It's actually a pretty simple breathing test. You take the deepest breath you possibly can, and then you blast it all out as hard and fast as you can into a machine. That machine then turns the volume and speed of your breath into a graph. Now, before we get into the problems, we have to know what normal looks like, right? On one of these graphs, a healthy breath makes this really clean, predictable loop shape. This is our perfect reference point. Okay, now look what happens when you have that blockage we talked about. For an obstructive disease, the part of the loop where you're breathing out gets all scooped out. See that? That shape is the visual signature of the struggle to push air past that clog. And what about restrictive disease? The graph tells a totally different story. Notice how the shape looks, well, normal, but it's like a miniature version of a healthy breath. This shows us the pipes are clear, but the total amount of air the lungs can hold is just way smaller. It's a perfect picture of that squeeze in action. These pictures are amazing for understanding what's going on, but they also give us hard numbers. And in medicine, it's the data that really tells the story and leads to a clear diagnosis. Okay, I know this table looks a little intense, but it's actually pretty simple. Let's just focus on two key numbers. FVC, that's the forced vital capacity, or basically the total amount of air you can breathe out. And FEV1, that's how much of that air you can blast out in the very first second. Now, the magic is in the ratio between them. With an obstructive disease, you can't get air out fast, so your FV1 is low compared to your total. That makes the ratio low. But with the restrictive disease, your total amount of air is small, but you can push that little bit out just fine. So the ratio looks normal or even high. That one number, that FEV1 to FEV ratio, is often the clearest way to tell these two conditions apart. So, after all the graphs and the data and the examples, it really all comes back to this one simple idea. Everything we just looked at is designed to answer this one basic question. Is the problem getting the air out, or is it a problem of getting enough air in? It's incredible, isn't it? That something we do without even thinking, a single breath, can paint such a clear picture of what's happening deep inside of us. It really makes you think, what can the simple act of breathing tell us about the complex health of our bodies?